Olukemi Olugbede. She's a public health physician, field epidemiologist, and of course, she will be joining via Zoom. And then I will be speaking to Dr. Patrick Eze. World Health Day, and of course, it's all about my health, my right. Stay tuned. Inside Today continues shortly. All right, you're welcome back. And if you're just tuning in, great choice. And look, talking about World Health Day and my health, my right. It's celebrated every 7th of April by the World Health Organization, talking about why it's important. Healthcare infrastructure is very important globally when it comes to the nation and the world, infrastructures, and being sensitized when it comes to the health sector. Most individuals out there find it very hard to subject themselves when it comes to great healthcare. Most people do not have access to healthcare. So we're going to be looking at some simple steps individuals can take to improve their overall health. Like I said, I will be joined by Dr. Kemi Olugbede. She will be joining us via Zoom, and she will be here soonest, as we all know. And like I said, most people find it very difficult to get steps to improve on their overall health, how it's hard for some communities to work together to promote better health and well-being, and the role of mental health, how it plays in all of this, the overall health, and how can we address mental health, which is a challenge, and how can technology and innovations contribute to the advancement in healthcare and public health, and of course, some key global health issues that we should be aware of and address collectively. Of course, we know about the coronavirus, we know about Lassa fever, just to mention a few, a lot, monkeypox, so on and so forth, how we can address it, how we can key to precautionary measures to avoid this sort of issues, that health issues who are hazardous to an individual. And like I said, we need to address what it is, why it is very important for public health and healthcare and public health sectors to come in when it comes to an individual's health, and mostly the challenges that we face when it comes to the infrastructure, when it comes to the machines that we need, when it comes to all of these gadgets to improve healthcare and health facilities. Now, like I said, happy World Health International Day. And of course, my health, my right is very important for you to understand that it is of importance to get your health checked. Being healthy is key. Being healthy is of importance. Many individuals find it hard to accept that fact. They feel because of the cost of health, of the health, the public health sector, it's easier to get self-medication, it's easier to prescribe your own drugs or meet quacks who will cause detriment when it comes to the health of an individual. All right, now let us just stay tuned. Insight Today continues shortly. And like I said, it's World Health Day. My health, my right. Stay tuned. Don't go anywhere. All right, you're welcome back for that very short break. And yes, it is World Health Day, my health, my right. And I am being joined by Dr. Olukemi Olugbede, and I'm so excited to have her on the program. Hi, Dr. Olukemi, how are you doing today? Like I said, she's a public health physician, field epidemiologist, and she is joining via Zoom. Hi, Dr. Kemi, are you here?
Yes, I am, Madam Jemima.
Hi. Oh, Dr. Kemi, it's great to have you on the program Insight today. I am so excited. Thank you for making yourself available.
Thank you for inviting me.
All right. Now, Dr. Kemi, I want to ask some issues. First of all, congratulations. It's World Health Day, my health, my right. Now, what are some simple steps individuals can take to improve their overall health?
Yes, thank you very much for your question. World Health Day is being celebrated globally, and many governments, countries, and public health institutions have been very active, and they've been very you know, positive about the campaign. The theme for this year is my health, my rights. So it is important that, people know their rights as citizens, and these rights are rights to universal health coverage. So what that means is that irrespective of your social status or your race or your cultural background, you have a right to access good health care without being pushed into poverty. So essentially, universal health coverage means that wherever people are, they have the right to access healthcare, and that healthcare must be accessible, must be available, must be acceptable to them, it must be affordable, and it must be of good quality. So for people to know their rights, they have to be informed. So health education is very important. Health awareness, just like your amazing program is doing, is important to let people know their rights. It's important for them to have correct and consistent and complete information about the different healthcare services, different essential services that they should be able to get when they go to a health facility or a primary health center or a secondary health center or a teaching hospital. And these services include maternal health, reproductive health, child health, care for the elderly,
Yes.
eye health, and the different components of primary health care, which is the care that is accessible to people in the community at the very basic level. So for people to know their rights, it's important for them to be informed. Then some other rights too are, their rights to privacy, their rights to confidentiality, and then their right to be part of their health management process. So what that means is that, when a healthcare provider is taking care of someone that goes to a hospital or a clinic or any kind of health facility, it is
Yes.
important that they are carried along. You know, it is important that their fears are allayed, they are reassured, they are informed about their diagnosis and their management process. That means they must be aware of their of the different kinds of tests that they need
Yes.
to have, and what the reason why they're having those tests, and the costs, and then options, especially if there are tests that can give the same results, but maybe their costs differs. So they have the right to know what options they have. In fact, you're also, as a patient or someone seeking healthcare, you have the right to a second opinion. If for any reason your healthcare provider has told you that, oh, I have, these are the things that I'm thinking about, and for one reason or the other you're not comfortable with the diagnosis or with the assessment, you can always get a second opinion. So you have a right to that. And then when it comes to the issue of privacy, privacy is a very sensitive issue, especially when it comes to examinations. As a someone seeking healthcare, your health provider might need to examine you if you have complaints about a particular body part or a particular structure, or maybe a particular part of the body is not functioning well, or there's a swelling. The person wants to see where it is, and maybe the size, the shape, the extent. They might say, oh, you need to undress. But if you don't feel comfortable, if, for example, the healthcare provider is male and the patient is female, and there's no chaperone, you can ask. It is your right to ask for a chaperone. Your right to, if there's no chaperone available, for a relative or a family member of the same gender as you to be present, and then your data too should be confidential information between you and your healthcare provider. And if
So
you do not want your data to be shared, you have a right to ask for privacy
I want to
concerning
ask a
that.
question, Dr. Kemi. Like the theme this year, World Health Day, says "My health, my right." Is it that most individuals do not understand that they have rights when it comes to health facilities, when it comes to that relationship between an individual and the health the health
Provider.
healthcare provider? Yes, it's that we do not understand what our rights are. That is why the theme is based on my health, my right. Because most of all of these things that you've said, some people do not understand the value in which it holds. That, okay, I have a right to ask questions. It's not what the prescription the doctor gives me that I will take. I should sit down. He should explain to me what all of these. I shouldn't just take it because he's the professional. So we have all of these rights, which are very important.
Exactly, absolutely correct. So it is important so it's two things. First of all, the theme is just to highlight the fact that health is a fundamental human right. And even though, everybody should have access to healthcare, for one reason or the other, due to different challenges, economic challenges, social challenges, political, issues, wars, conflicts, violence, infrastructural, destruction and all that, especially in places where, there are ongoing wars and all that. People
Exactly.
have, access to health, they don't have it. So the theme is also trying to, shed light on, the different, challenges going on globally. It's a global health issue,
Yes, it is.
especially in some countries where there is ongoing violence and wars, and people are displaced and they don't have access to health because of those situations, which is their right. So that is one. Everybody needs to have access to health, but unfortunately not everybody does. Another thing is the fact that it is important to know that, aside that you have, that health is your right, you should know what those rights are. And that's what we're talking about. That, as health seekers, as patients, as clients, you have a right to, accessible, affordable, acceptable quality health care. You have a right to be carried along and be informed in the processes regarding your treatment. You have a right to privacy,
Exactly.
confidentiality, and respect while you are getting this care or service. And then you also have a right to the provision of basic essential medical services, depending on maybe your age or your gender or your special or peculiar needs.
I
Okay, so
understand.
those are the things that this theme is trying to highlight.
I understand. Now, I want to talk about the role. How does the role of mental health play in overall health? And how can we address mental health challenges? Because we have a lot of that from depression and all of that. How can we address this overall health challenge that most people face when it comes to mental health? Their rights. What are their rights when it comes to mental health challenges?
Yeah, so very, fantastic for you, raising and highlighting that point, because as part of, the health rights that everyone should have access to, it's also, the right to good mental, health and good mental health care, and mental health is a very important component of overall health, even in the definition of health, according to the World Health Organization. It has to do with having is a state of complete physical, social, economic, and even mental well-being. So there's this saying that there's no health without mental health. So a person could be, socially, economically, and maybe physically healthy, but when the mental component of his or her health status is not present, the person is not fully well, the person is not fully stable. So mental health is a very important aspect of healthcare, because it has to do with your emotional and psychological well-being. It has to do with the state of your mind, having a stable state of mind, having balanced emotions, and being able to interact with people in your community, in your society, in your home and workplace, without any, rancor or, challenges. In communication, you are clear, you are easy to understand, and there's no ambiguity with what you're saying. Because once there's a dysfunction at any of these levels, if there's a problem with the mind, or there's a problem with interaction, or there's a problem with socialization, or even how a person sees themselves, then their mental health has been affected. So the mental health rights that people have is that they have the right to be listened to. They have the right to be, understood. They have the right to not be stigmatized or discriminated because of their peculiar, mental health status. That's for those who have maybe mental illness or mental health disorders. They have a right to be taken care of. They have a right to access, the healthcare services like every other person. And then in the process of receiving healthcare, they should be listened to, they should be
Accepted.
accepted, and they should have access to affordable healthcare that can improve their quality of life. Now, what helps people to know these mental health rights is exactly what we're doing now. It has to do with awareness, it has to
Great.
do with information, it has to do with health education, and then disabusing and dispelling, disabusing people's minds and dispelling myths about, you know, mental health or mental
Exactly.
illness. So because there's this impression that people that have mental health disorders or mental illness, they are possessed, they
Yes.
are
They're
they
crazy.
have spiritual problems. They use a lot of terms, degrading terms to describe
Yes.
them, like lunatics or they are mad. Those are very unacceptable words, they are
Yes, it
unacceptable
is. Yes,
terms,
it is.
because the thing about mental illness is that just the same way a person can have a physical illness, a person can have hypertension or diabetes or malnutrition. It's the same way a person can have mental illness. It
Very
doesn't
true.
mean the person has a spiritual problem, or the person needs to be chained, or the person needs to be whipped or beaten. Those are, that is abuse already. That is degrading, and that is already, infringing on the person's rights. Even if a person has a mental illness or a mental health disorder, they have a right to be protected and to be properly treated. So it is
Very
important
true.
for us to create awareness about mental illness, for people to know that the same way there are physical illnesses, there are mental illnesses. And many times, especially when it comes to things like anxiety or depression, there are not things that people can just wish away, or just, when people say things like, oh, snap out of it. It's not something people can snap out of. Many times they'll need emotional support,
Yes.
psychological support, counseling, therapy, even, depending on the severity, they might need medication as well, and
Very true.
rehabilitation. So it's very important that, we strengthen the mental health services in our country, especially at the public level. There's been a lot of support at the private level, private sector level,
True.
NGO, and a lot of advocacy groups, and a lot of virtual consultations by new mental health organizations. So in the public sector, what needs to be done is to strengthen, the mental health at the grassroots level, okay, and to also strengthen the referral system at the secondary and tertiary level,
Okay.
such that when people are, detected to have, mental health challenges, then they can be referred on time, so that they can get better on time as well. So
Okay.
instead of taking people to places for deliverance, or where they'll be
I was going to
beaten,
mention that. Funny enough,
chained,
I was
yes,
going to.
they should be
I was going to
taken
mention that.
they should be taken to the hospital. They should be taken to a
Exactly.
clinic or
You.
a health facility that has the capacity to take care of them. And the people that
Exactly.
can take care of these people are mental health specialists. They could be psychologists, they could be
Yes.
psychiatrists, they could be mental health therapists, and a lot of rehabilitation centers are also springing up, because there are very few psychiatric hospitals in Nigeria at the
Yes. Yes.
moment. So there's one in each geopolitical zone, but it's
Yes.
been seen
Yes.
that they are overwhelmed, and the human resources for mental health in Nigeria has significantly depreciated. A lot of
Yes. It's
mental health,
limited.
practitioners have vacated, and right now, for those that are remaining, they are less than 300. And considering our population, that means we are seeing only just maybe one psychiatrist to about 1 million people.
Wow.
So we need to strengthen the healthcare system and train more people, in mental health care, so that they can also, ensure that the rights of people who have mental illness or mental health disorders are protected, and those that are even sort of at risk do not tip over and become severely ill, because there's so much stress and challenges that can tip people into becoming mentally
I'm not talking,
unwell.
it's still adding stigmatization that's attached to all of these mental health issues. All right, Dr. Kemi, I want to ask you one last question before I wrap it up at about this point. Now, let's talk about technology and innovations. How do they contribute to the advancement in healthcare and, of course, public health?
Yes, fantastic question. So technology has been a very, useful tool in medical, in delivery of medical services. There's so many innovations and technology that is being used to make our work easier, especially when it comes to diagnostics. Even before, one of the things that made technology a very veritable tool in delivery of health services was COVID. So a lot of people had to
Exactly.
find creative means to assess patients, to that's in terms of accessibility, and then in terms of being able to assess what is wrong with them. So even though there was a pandemic, there were lockdowns, there were restrictions with movements, people were still able to consult online, so that was an innovation that was applied, that's telemedicine, virtual consultations, to, see a doctor,
But Dr. Kemi,
irrespective of your
I
location.
want to ask a
So
question.
telemedicine has been very useful. And then the use of artificial intelligence too for diagnostics has also been very
But
useful.
Dr. Kemi, I want to ask a question when it comes to virtual. You mentioned there was something you mentioned right now.
Telemedicine,
Exactly. How
virtual.
accurate is that? You're seeing your patient virtually, but how accurate can you assess a patient and know this is the diagnosis and this is the treatment that is relevant for that particular issue? How accurate?
Yeah, so it has a lot, there are different dimensions to it. So it
Okay.
depends on what kind of, complaints the person has, because essentially in our practice, it's very important to, communicate with your patients, take a
Great.
history, do a physical examination, you know, investigate, that's do tests, and then get a diagnosis.
Okay.
So based on, those criteria, telemedicine is, it can work to make those situations possible. Even via telemedicine, depending on the, how will I put it now? Depending on the grade or the level
Okay.
of
The
what
level
kind
of
of
attention.
telemedicine tools that you are using. There's some telemedicine tools that can take x-rays, there's some telemedicine
Oh,
tools that can do scans, there's some telemedicine tools that, the person would have done their tests and those tests can be uploaded, and then the healthcare provider can view, the x-rays or view the scan reports, and then the person is guided. Okay. And then there are also some telemedicine um, tools that you can attach to, some particular devices that can even transmit sounds, so the way a doctor will use a stethoscope and listen to the heart or listen to the chest, there are some devices that those sounds can be recorded and they can be uploaded, and then the healthcare provider, the doctor, can listen and say, oh, okay, these are the heart sounds I'm listening to, there are no murmurs, or oh, okay, these are the chest, the breath sounds, this chest is clear, or oh, this chest is not clear, so those kind of things are possible with telemedicine depending on the, the device capacity, but it's better than nothing, and so like during the pandemic where there was lockdown and restrictions of movement, that is what, saved a lot of people's lives, because there was challenges getting to the hospital, so it was just something that could bridge the gap. And then if the person is assessed and is seen to be an emergency, of course that kind of person has to be moved to a hospital. So it was just a bridge, but it's not, absolutely devoid of its own challenges, but it's better than nothing.
Much for being a part of Insight today and keeping us well informed when it comes to World Health Day. My health, my right. Thank you so much. Hope I'm going to call you more on the program. Thank you. The beautiful, amazing Dr. Olukemi Olugbade. Thank you so much for being a part of Insight today.
It's been great being on your show. Thank you for the
Thank you.
invitation.
And of course, Dr. Olukemi Olugbaide, she is a public health physician, field epidemiologist. And thank you so much for being a part of the program. Let's quickly go on a break. And part two returns with an interview by one of my colleague, Fauzia, who actually interviewed a doctor, Dr. Patrick Eze, who threw more light on World Health Day. That was yesterday. Stick around and do not go anywhere.